Hello, my name is Garry and this is my quality improvement project for ATRN 7110, quality improvement and patient safety. So my quality improvement project is a goal of all athletic trainers, and probably the nemesis of most secondary athletic trainers, and that is the junior high athlete that constantly comes in and complains of patellofemoral syndrome, pain or discomfort, in turn taking up valuable time in the trainer. So my project is something that's going to look at adding exercises to warm-up drills for the sporting events, for these sporting teams, so that they can integrate these exercises into their warm-ups to help to alleviate the potential for patellofemoral syndrome discomfort. Now, the ultimate goal of this is to decrease total athletic training visits by students that have patellofemoral syndrome discomfort by 50% when compared to previous years. So, if we have 21 year, our goal is to go to 10. If we have 51 year, our goal would be 25. But on average, over the last couple of years, we're looking to decrease that significantly from all junior high sports across the board. Now, I'm starting out small with my project, and the main purpose of my project is to start with my junior high basketball teams. It's a controlled environment. They're inside every day. They have a set routine set forth by the varsity coach as far as stretching and warm-up, so that'll be the most easily implemented ones. I'm able to control the setting a little bit more because they are inside. I know where they're going to be every day. I know their practice schedule, and we'll implement that with both sporting teams, which will give me a total of 24 total athletes, because each team will have 12 teams. Now, one aspect to remember is when I'm discussing junior high athletes, I'm talking about 7th, 8th, and potentially some 9th graders, depending on their sport. So in the winter, dealing with the basketball teams, my student athletes will consist of 7th, 8th, and 9th grade basketball players. Each team is a separate team, consisting of 10 to 12 people on each team. So I guess with boys and girls, that would put me closer to 60. The ultimate goal is to have every junior high team doing these exercises to decrease totally the number of total patients seen for patellofemoral syndrome pain by 50%. Now, I understand that there are student athletes that have discomfort in their knees as they're growing up. So I don't think there's too much of a realistic goal of going over 50, maybe 60, 70%. Obviously 100 I feel is completely out of the question, only because of the situations with students that have pain and things like that. So as I'm going through my project, obviously the number one goal is to maintain and ensure the safety of the student athletes. That's obviously my number one goal. And the goal with that is to determine that by doing this type of exercises, we're able to help them not only potentially in their athletic stance, but also potentially in life as well. Students that develop patellofemoral pain probably have pain while they're walking, doing fun activities, even weekend things. So the goal would be, the outside goal, if we're really trying to take this outside of the athletic realm a little bit, would be just for the person to function normally on a daily basis. So one of the things that we needed to do throughout this was our flow chart, which you kind of see behind me. So the flow chart that I'm looking at here is what do we do with an athlete that comes in complaining of patellofemoral pain? What are our steps? Okay, well, first off, I'm not going to be able to tell, obviously, a patient has patellofemoral syndrome pain, discomfort immediately upon them walking into the room. So the first thing we're going to do is we're going to evaluate the patient's knee. Okay, so the injured athlete comes in with knee pain. We're going to evaluate them. We're going to determine, does this patient have patellofemoral syndrome pain? If yes, we continue to go down. If no, we need to determine what other issue it is. Okay, maybe they have patella tendonitis. Maybe they have some type of chondromalacia starting with some movement in their knee. So we need to discuss that, and obviously that's a completely different course of action. So we're going to stick with this. Yes, we need to speak to the parents. Okay, now if the kid comes in at the end of practice, my knees hurt, we're going to give them a bag of ice, see how they feel before practice the next day. A lot of the athletes that I'm dealing with at the start, some of that pain will alleviate based on the fact that they just exercise for 2.5 hours. Maybe that is causing them some discomfort. So what we're going to do is we're going to speak to the parents a little bit, say, hey, this is what we're looking to do, and go from there. So the next step is going to be, do we need to see a physician? Okay? If that answer is yes, that kind of stops everything for me, in my opinion. Because at that point, then the physician's going to dictate exactly what we do. Okay? I think we all are aware of the family physician, the rubber stamp 2 weeks. We could all be physicians if that was the case. But hopefully we can convince them to go see our team physician, our team orthopedic, or team sports medicine doctor that's going to allow us to kind of dictate what they're able to do. So physician, no. Okay? Now this kind of goes along with the presentation we heard with last week with procedures of athletic trainers, which is obviously very important. So we go to no. Can the athlete practice at all? Okay? Be it full practice or modified. Okay? So maybe what we do is modified practice. They go out and stretch, they do some, depending on the sport. Maybe they do some drills, maybe the athlete just doesn't scrimmage, or they don't do conditioning, or instead of conditioning, they ride the bike, or maybe they do push-ups and sit-ups and stuff like that on the side. Okay? So full modified. Modified, can they do any running? Yes or no? Yes, until discomfort starts, then obviously they'd stop. Can they do running? No. We're going to do some type of alternative workout agreed upon the athletic trainer, the coach, potentially the physician, and then we'll go from there. But let's come back over here. Full athlete practice. Full. If full practice, obviously no restrictions. We're not going to restrict someone who can do full practices. If they can, if we have any issues, then we'll treat the symptoms as needed. Some athletes, okay, especially a ninth grader who this might be their third year in the sport, they might say, hey, this is something that happens to me at the start of every year. I know as I go through it's going to happen, but I can still practice. All right. So those are the types of things that we're going to be looking to do as far as being able to get into this process. Now, the ultimate goal is what am I going to do as the athletic trainer to prepare my coaches? So my sports team, my team's going to consist of myself, the athletic director, or an athletic administrator of some kind, the team physician. They need to be able to back me, especially if I send a kid there who has patellofemoral syndrome discomfort. The coaches, and anybody else that may be involved in the athletic program at the time. The athletic director or administrator would give me time. I would spend time teaching the coaches how to integrate the particular exercises into their programs so that they're able to decrease that discomfort. Okay? Again, our ultimate goal is to decrease the pain and discomfort, the number of visits by 50%, allowing the athletic trainer to do more with their athletes, more with other athletes that have more serious injuries, spend some more time with the varsity, get people out to practices quicker, stuff like that. That's one of the ultimate goals to do. Okay, so my ultimate plan with doing this is to start small. I'm going to start with a smaller team, something I can control, kind of work out the kinks. If I start with an outside sport, maybe they're going to be in the gym one day, that's going to limit our space. So I want to do something that we can maintain some level of consistency. That's why I've chosen the basketball teams to start with. Okay, so ultimately, potentially, the only kids we would need to teach every year as this plan continues to go into motion would be the 7th graders coming into the new sport. And eventually the coaches wouldn't even think twice about it. Okay, now, if this plan doesn't work, we need to figure something else out. Maybe it's something the coaches are doing in practice. Maybe it's a technique thing that we need to be able to deal with as well. Okay? But overall, the ultimate goal of my plan is to help the student athlete decrease their patellofemoral syndrome discomfort by including exercises in their warm-up plans that are going to allow them to participate in their sport fully without discomfort. And that makes the coaches happier, it makes the athletic trainer happier, most importantly, it makes the athlete, and in the high school setting, it makes the parent happier. Thank you for your time, and look forward to your feedback.